Let's get started. Okay, a very good evening to everyone with us on this live session. I'm sure a lot of more people will be joining in very soon. I am Dr. Shashanka Dhanuka. I'm a consultant urologist and neurosurgeon, presently practicing at Medica Super Specialty Hospital, Kolkata. Before this, I was working as a consultant urologist at the Royal Blackburn Hospital in East Lancashire Hospitals NHS Trust in the United Kingdom. Today I'll be talking about kidney stones. This video is aimed for the common public. It's for public awareness, and I'm sure at the end of this video all of you will have something to take home, something added to your knowledge of kidney stones, and you'll better know how to prevent kidney stones, and if you do have them, how to get treatment, how to get them removed from your body. Alright, so what are kidney stones? The urine contains a lot of minerals and salts dissolved in it, and there are multiple factors which are responsible for the dissolution of these elements in the urine and crystallization of these elements out of the urine. Stone formation occurs when the delicate balance between the dissolution factors and crystallization factors is disturbed. So when these minerals and salts get crystallized, they lead to the formation of stones. Stones can be formed anywhere in the urinary tract. It could be in the kidneys, it could be in the narrow tube that connects the kidneys to the bladder. It's called the ureter, and it could be formed in the bladder as well. So we will discuss about kidney stones under 6 headings today. 1. The symptoms of kidney stones. 2. What are the stones made of? What are the common types of stones? 3. What are the causes of kidney stones? 4. How do you get diagnosed? 5. What are the treatment options available in the present world? And 6. How to prevent further formation of kidney stones. So let's get started. Okay, what are the symptoms of kidney stones? The first and foremost thing that brings a person to the doctor's office is excruciating pain. This pain is usually very sudden in onset. It's located on what we call the side or the back. It's called a flank pain. It usually comes on very suddenly, and it is usually very severe. There's no particular posture in which you feel relieved, and you usually need medications, painkillers, to get rid of this pain. Sometimes this pain moves from its original location down into the groin. It could be radiated to the medial aspect of the thigh. Sometimes it is also perceived at the tip of the penis in men and at the sides of the labia in women. Along with this, there may be an intense urge to urinate. This is also due to a stone, usually located in the ureter, the pipe that connects the kidneys to the bladder. Another symptom of kidney stones can be the need to go to the bathroom more often than normal. Sometimes one can see blood in the urine. It could be dark red or it could be fresh blood. There may be clots as well, along with stones. When stones are obstructing any part of the urinary tract, it may cause nausea and vomiting in the person as well. And if there is secondary infection, it may lead to features of sepsis like fever and other things. So coming to the second point of what these stones are made of. As most common people would know, 80 to 90% of stones are made of calcium. So calcium stones are the most common type of stones in the urinary tract. Calcium stones can be calcium oxalate, which is the most common type of stone, and also calcium phosphate. It is basically the type of mineral with which calcium combines to lead to the formation of the stone. The calcium oxalate or calcium phosphate stones can be located anywhere in the urinary tract. They usually form in the kidneys. The smaller ones sometimes make way into the water pipe, into the ureter, and sometimes get blocked there. The second type of stones are the uric acid stones. These are usually 5 to 10% of the cases of kidney stones. Uric acid stones can be formed in people who have high uric acid levels. They may have bone pain, joint pains, what we call gout. They may be formed even in the absence of joint pathology. Uric acid stones usually form in acidic urine, and there are many causes for the urine to be more acidic than normal. Being overweight, suffering from chronic diarrhea, being a diabetic, suffering from gout, all of these are causes of a more acidic urine. As you can imagine, a lot of people are overweight, a lot of people are diabetic. Quite a few people suffer from gout, but they may not be aware that their urine is more acidic than normal, and they are at an increased risk of developing uric acid stones as well. The third type of stones are struvite stones, what we call as infection stones. These are comparatively more common in India and Southeast Asia, less common in the Western world. One of the reasons these stones form is the occurrence of recurrent urinary tract infections. One of the organisms, namely Proteus, causes the urine to become alkaline. And these stones usually form in alkaline urine. The main chemical constituent of these stones is magnesium ammonium phosphate. We also call it triple phosphate. And these type of stones are usually, they attain really large sizes. Some of the big stones formed in the kidneys that attain the shape of the kidneys collecting system are known as staghorn stones. Most of these staghorn stones turn out to be struvite stones. So if a person is having recurrent urinary infections, it is imperative that they seek treatment and get rid of this infection as soon as possible, because they are also at a higher risk of getting urinary stones. Another less common type of stones are the Sistine Stones. These are usually formed in people with some metabolic disorder, and they're suffering from a condition called cystinuria. These are relatively rare, accounting for about 1% of the cases only. Coming to a much more important part of the talk, what are the causes of kidney stones? Why do they form? Point number one, and probably the single most important thing that I want to emphasize to everybody listening to this talk, is low urine volume. So you need to understand that it's the urine volume that we are talking about, and not the amount of water that you're drinking or the kind of environment that you're living in. You need to have a good amount of urine output. A good urine output would be at least 2.5 liters of urine every day. A very good way of knowing your relative state of hydration is the color of your urine. It is supposed to be a very clear, pale straw colored. If it is getting high colored, it's the easiest way to know that you are dehydrated. You're not consuming water or fluids in proportion to your needs. Sometimes a lot of people tell me that I sit in an air-conditioned room all the time. I work in an air-conditioned office. I hardly do any labor. I hardly sweat. So why do I need to drink that much water? It is very important to understand that whether you're working in the sun, whether you're working in a humid environment and sweating a lot, or whether you're seated in an air-conditioned room throughout the day, your body is losing a lot of water through your skin. It's called insensible water loss. It dehydrates you. So you need to develop the habit of consuming water every now and then, drinking a glass every hour if possible, so that you can have more than 10 to 12 glasses of water through the day. A good fluid intake for a person in India, the kind of weather we have in India, would be definitely 2.5 to 3 liters. For a person who has had a history of kidney stones, it should be at least 3 liters every day. A lot of people ask me about the type of fluids. So water obviously is the best, as much as possible. If it is difficult for you to consume large amounts of water, lemonade without salt. So lemon water or any other clear liquids is fine, as long as you're hydrating yourself. There is a problem with salt. I'm coming to that in the risk factors that I'll be discussing. And there is also a problem with the carbonated beverages, the cold drinks, the soda drinks that are very common. They increase the risk of stone formation because carbonated drinks increase your urinary excretion of oxalate. And cola in particular, the black drink that a lot of people love to have, increases the phosphate excretion in your urine. Both of these are responsible for the formation of calcium stones, calcium oxalate or calcium phosphate. So sodas and carbonated beverages are not a great idea. They increase your risk of kidney stones. The second thing is your diet. In diet, I would like to emphasize upon the need to consume more fruits and vegetables. So animal proteins, primarily the red meat, whether it's pork, whether it's beef, whether it's chicken, fish, all of them make your urine more acidic and increase the risk of kidney stones. So if a person is consuming a high proportion of animal protein in his or her diet, his urine is more at risk of forming stones. Among fruits and vegetables, there are a few things that you need to be careful about. For example, the high oxalate foods. So there's a common list of things that you can find anywhere if you just Google about high oxalate foods. The most common culprits are beans, berries, coffee, chocolate, nuts. So if you're having a big bar of a nutty chocolate along with a large mug of coffee, it's not a great idea. You're loading yourself with a lot of oxalate. Beans, berries, chocolate, coffee, tea, and nuts, primarily almonds, and among the veggies, spinach primarily is very high in oxalate. So these are oxalate-rich foods. If a person is at risk of forming stones or has a history of kidney stone, they should avoid high oxalate foods. Animal protein, as I said, should be kept to a minimum. You can replace it with other sources of protein. Plant proteins are fine. And a good amount of fruits and vegetables, at least 5 servings of fruits or veggies every day. In the UK and US, it's a routine practice to teach the kids to consume 5 servings of fruits or veggies. One single fruit or a bowl of fresh cut fruit or vegetables is considered to be 1 serving. So in the whole day, you must consume 5 servings. It could be 2 full fruits and 3 bowls of fresh fruits or boiled vegetables, whatever you like. Alright, the next thing, the third cause of kidney stones. 1 was a low urine volume, 2 was your diet, 3, certain bowel conditions. People suffering from diarrhea, inflammatory bowel disease, diseases like Crohn's disease, ulcerative colitis, they are more prone to forming stones. This is because the absorption of various minerals is hampered in their intestines, and it shifts the balance of the urine towards crystallization. The dissolution factors are not absorbed and they have more stones in their kidneys. So that is another risk factor for the formation of stones. Even those who have had gastric bypass surgery are more prone to forming stones. So they need to be careful about that. The fourth risk factor or cause of kidney stones is obesity. As I said a while earlier, a very common pandemic. So everybody is talking about the coronavirus pandemic. But obesity, diabetes, hypertension, these diseases have been a global pandemic for a long time. And it's increasing at a crazy rate every day. Obese people have more acidic urine, their urines have more oxalate, and the urine is more prone to forming stones. So weight loss and trying to get rid of obesity is definitely a step in preventing the formation of kidney stones. Metabolic syndrome, which is basically the constellation of obesity, hypertension, dyslipidemia, raised cholesterol and stuff, and diabetes. This is a very common occurrence and it's increasing every day in the middle-aged population, more so in India in the recent few years. This is directly a risk factor for the formation of kidney stones, so we need to be careful about it as well. Another cause or risk factor for the formation of kidney stones are a few medical conditions. So just getting into a small aspect of calcium. The level of calcium in our body is regulated by multiple glands in the body and multiple hormones that maintain a delicate balance of calcium in the body. One of the glands, called parathyroid hormone, it sits in the neck, somewhere in association with the thyroid gland. It secretes a hormone called the parathormone, which controls the level of calcium in the body. Some people suffer from a condition called hyperparathyroidism. These people have high levels of calcium in their blood and sometimes high levels of calcium in their urine. These people are also prone to formation of kidney stones. Other conditions like primary hyperoxaluria, where a person secretes more oxalates, also predisposes to formation of stones. Some medications. So one of the things that a lot of people are consuming these days is a vitamin C tablet. Although vitamin C is freely excreted in the urine, vitamin C is known to increase oxalate excretion in the urine. So it's good to have vitamin C for prophylaxis against coronavirus or to improve your immunity against flu. But if you are overdosing on vitamin C or taking a lot of vitamin C over a long period of time, the oxalate levels in your urine are going to increase. And this may also increase your risk of kidney stones. Some calcium supplements, if taken without proper supervision, can increase the risk of stones as well. Some people worry about the content of calcium in their diet. I would like to emphasize that it's not the calcium in your diet that's going to increase your risk. Studies have shown that an adequate amount of calcium in the diet is necessary to prevent the formation of stones in the kidneys. So if you're cutting down on your calcium intake through your diet, you're actually increasing the risk of kidney stones. You must have an adequate amount of calcium in your diet. It's important for your bone health, and it's also important to prevent formation of kidney stones. Another cause of formation of kidney stones is a family history of kidney stones. So if any close relative, first degree relative in your family has had a history of kidney stones, it does have a genetic link, it does have a hereditary link to it, and family members are more at risk for formation of kidney stones. Alright, so we've talked about the symptoms of kidney stones, and we've talked about the common causes of kidney stones. Let's see. Shall we go to the diagnosis of kidney stones? Okay. So how do we get diagnosed? Somebody just asked, can I have a stone without me knowing about it, without any symptoms? Yes, absolutely. With increased imaging, we get a lot of people that get diagnosed with kidney stones in the absence of any symptoms. So I'll tell you how it happens, or how do you get diagnosed. One of the ways a person gets diagnosed with kidney stones is when they undergo an imaging for some other problem. They may be having some other problem, they have an X-ray or an ultrasound scan, and a small little stone gets picked up in those scans, and then they're referred to a urologist, and they're worried about how they got a stone. That is absolutely possible. That is because the stone is sitting at a location in your urinary tract where it is not causing any obstruction to the kidneys, where it is not causing any infections, and thus it is not causing any pain or any symptoms whatsoever. But the detection of such a stone does tell you that you already have a stone in your urinary tract, and you can change your diet, your lifestyle, you can improve your hydration to prevent the probability of more stones from forming. One of the risk factors for kidney stone formation is a personal history of kidney stones. So a person, if he has a history of having a kidney stone, they have a 50% risk of having another kidney stone in the next 5 to 7 years. You can only bring down this probability with lifestyle modification, with your diet, with your hydration. So if you've had a kidney stone once in your life, you need to make the necessary changes to your lifestyle, get rid of all those risk factors as far as possible. That brings down the percentage risk of you having another episode of a kidney stone. So how do you get diagnosed? When a patient presents with one of the symptoms that I earlier discussed, they undergo an imaging test. Earlier it used to be a plain X-ray. So 80 to 90% of the kidney stones or urinary stones are visible on X-ray of the KUB. 10% of stones are not dense enough to be seen on an X-ray. The other modality is an ultrasound scan. Ultrasound scans are not very sensitive at detecting a kidney stone, but they do pick up some silent stones, and larger ones of course. They also pick up any swelling or dilatation of the kidney. If the kidney is blocked and it starts swelling up, it's very well picked up by an ultrasound scan. The most sensitive test to detect renal stones or kidney stones or urethric stones is a CT scan. It has a very high sensitivity and very high specificity. So if you are consulting a urologist for symptoms suggestive of a stone, or if a stone has been picked up on an ultrasound scan or an X-ray, your doctor may order for a CT scan to confirm the stone. It will also give information about the number of stones, the location of the stones, the density of the stones as well as more information about your kidneys, ureter and bladder. So the CT scan is the best way to get diagnosed and then plan treatment as well. Alright, coming to the treatment or management of kidney stones. So how do we treat kidney stones? The treatment of kidney stones is totally dependent upon the number of stones, the size of the stones, the location of the stones, and what your health condition is. So if you're having an infection, if you're having an obstructed kidney, the treatment plan may be completely different from a same size stone causing no symptoms and being detected just incidentally on a scan. So the treatment options include, number one, wait and watch. There are certain stones that are small enough to pass on their own. In the absence of any complications, in the absence of any pain, in the absence of any infections, and if the stone is small enough to pass on their own, watchful waiting for 4 to 6 weeks is one of the strategies for managing kidney stones. The second treatment strategy is medications. Technically, it's called medical expulsive therapy or medical expulsive treatment. It includes a medicine that helps to relax the ureter, the pipe that connects the kidneys to the bladder, and that helps easier, smoother passage of the stone if it is blocked in the ureter. It also includes painkillers which also decrease the inflammation in these tubes and thus help the stone to go down smoothly, along with proper hydration, increased water intake to at least 3 to 3.5 liters or even more, so that the stone may be flushed out with the urine. The next treatment option is intervention in the form of surgery or in the form of a shockwave lithotripsy. Shockwave lithotripsy is a mechanism in which certain shock waves emitted by a machine are focused onto the stone with the help of an X-ray or an ultrasound. These cause vibration in the stone and help in the breakage of the stone. Once the stone breaks into smaller fragments, small enough to pass on their own, the patient is advised to drink plenty of fluids over the next week, and they usually pass the fragmented stones, sometimes as small as sand particles, in the urine, and they are free of stones within a week or 2 weeks after the procedure. This procedure is usually a daycare procedure, so you don't need to get admitted to a hospital for it. It involves being admitted with some preliminary blood tests, obviously ruling out infection and checking a couple of other things. The procedure takes a while, about an hour or so, and there may be some localized pain. So sometimes it's done under some local anesthetic, depending on the tolerability of the patient. After the end of the procedure, the patient is observed for a while, and then they can go home with certain medications. They may notice some amount of blood in their urine, some burning sensation in the urine, and passing some grit-like material, which might be the fragmented stones. The success rate of this procedure is in the range of 60 to 70%. The success also depends upon the density of the stones and their location. The next treatment modality is Eurythroscopy. So, going back slightly into the history of kidney stones, before I go into the surgical treatment options. Kidney stones are known to man for thousands of years. There are documents that are 4,000, 5,000 years old, which have mention about kidney stones. Even the Hippocratic Oath, dated 500 BC, so that's about 2,500 years ago, mentions about kidney stones. And very cleverly, Hippocrates mentioned that I will not cut, not even sufferers from stone, but I will give place to workmen who engage in this practice. So he hinted at specialists who deal with stones, who operate on stone patients in 500 BC. That's 2,500 years ago. But technology has made massive progress in this field, and with the advent of endourology, in 1978, Professor Arthur Smith coined the term endourology, and this has changed the whole way in which stones are managed in the current world. The progress in the last 40 years are much, much, much greater than in the last 4,000 years. So keyhole surgery, as most people understand, or minimal access surgery, natural orifice surgery, all of these are synonyms for endourological procedures. So a stone in the kidneys or in the water pipe connecting the kidneys to the bladder, the ureter, can be treated by passing a narrow camera telescope either through the bladder into the ureter or by making a really small hole over the back and directly accessing the stone inside the kidney, breaking it with different kinds of energy sources and getting rid of the stones completely. The recovery after such procedures is fairly rapid. A person is good to resume their normal activities within 2 to 3 days, compared to earlier when large open operations were required for stones and people used to need about 2 to 3 weeks to recover from those. So, coming to Eurythroscopy. So Eurythroscopy is an endourological approach where a narrow telescope, there are two types basically, the semi-rigid telescope and a flexible telescope. Depending on the location of the stone, the surgeon decides which instrument to use. There are different kinds of energy sources. There's a lithoclast, there's laser, which is the most commonly used energy source in the present world, and it helps to break almost all types of stones. So Eurythroscopy is a minimal access approach to treating kidney stones. The risk of bleeding, the risk of complications is definitely much smaller than open surgery. The recovery is much faster, and the clearance of stones is fairly high. With improvements in technology of the cameras, the telescopes, the energy sources, these procedures have become very efficient in the present world. There is no reason why a person should even think twice before undergoing these procedures. If you've been detected with a stone and you've seen a urologist and they have recommended a procedure like this, there is no reason for you to worry. You should just go ahead and get the procedure done. It's the single best way to get rid of stones. The third, the gold standard surgery for kidney stones is the percutaneous nephrolithotomy. That's the technical name of keyhole surgery into the kidneys. A really small incision, a really small hole is made over the back with the patient under general anesthetic, completely put to sleep. Usually it's done under general anesthesia, and through this hole the stone is accessed directly by passing a small plastic tube into the kidneys and then using a rigid telescope known as a nephroscope. The stone is seen and then broken using different kinds of energy sources, and then the fragments are either removed or flushed out. Usually after a Eurythroscopy or a PCNL operation, a stent is put into the kidneys, down into the ureters, up to the bladder. A stent is usually a narrow plastic tube that helps the ureter and the kidneys to heal after the procedure has been done. This tube needs to be removed later, usually after 1 to 2 weeks after you've had the procedure. Percutaneous nephrolithotomy or PCNL is the gold standard in the treatment of kidney stones because almost all kinds of kidney stones can be managed by this approach. There is a risk of bleeding, infections, and sometimes the need for additional procedures after a PCNL, but the success rate is very high. It's usually greater than 95% for PCNL. The need for additional procedures is fairly small, and a person recovering from PCNL takes only 2 to 3 days before they can get back to their normal activities. I think we've covered about the symptoms of kidney stones, the causes of kidney stones, the diet related stuff that everybody needs to know, how you get diagnosed, and the various treatment options of kidney stones. I think one more thing that I would like to emphasize before I finish this talk, and then I'll have a quick look at the questions that people have put in on the chat. I'll just scroll through your messages at the end of my talk. I'll just wrap up for the next 5 minutes with some advice about how we can prevent. So basically, if you're aware of the risk factors, you can prevent kidney stones. Number 1, drink enough fluid each day. This is the single most important advice that I would like to give to everyone. As often as you remember to wash your hands, so if you're hydrating your hands, hydrate your body. Remember, if you're washing your hands, if you're hydrating your hands, your body also needs to be hydrated. So drink a glass of water every time you're washing your hands in the current ongoing pandemic. And make sure you're producing at least 2.5 liters of urine every day. Or your urine is of a clear, light, pale straw color. Alright? And consume clear fluids, avoid carbonated beverages, avoid too much of tea and coffee, drink lemon water if you like. You can have citrus juices like oranges, lime, and you're advised not to consume soda and carbonated beverages. That's something that causes an increased risk of stones. Alright, the next advice is reduce the amount of sodium in your diet. This is very important, more important in India, because in almost all parts of India, we consume lots of food that is very high in salt content. So your salt content needs to go down. Whether it's the salt-rich snacks, whether it's additional salt that you add to your salads or vegetables, whether it is packaged food, whether it is bottled sauces or pickles, all of these things are very high in salt content. You need to cut down on these. You need to cut down on your salt intake. The DASH, or the Diet for Controlling Hypertension, recommends cutting down on your sugar and salt intake. This diet is also effective in bringing down the risk of kidney stones. So you need to cut down on your salt intake. About 2.5 grams of salt is safe for almost everyone, but the amount that we consume daily is far greater than this in most diets across India. So you need to make sure you're cutting down on packaged food, on bottled pickles, bottled sauces, on salt-rich snacks, on adding salt on top of your salads, and anything that is, even cheese. Cheese is very high on salt content, so control your cheese intake as well. Okay, point number 3, eat plenty of fruits and vegetables. So remember to take your 5 servings every day. Teach your kids to take 5 servings of fruits and veggies every day. You could divide it during the day the way you like, but make sure you're consuming fresh fruits and fresh veggies adequately in your diet and cutting down on your animal protein intake. Okay, oxalate food, rich foods. So as I told earlier, cut down on your oxalate rich food intake. That includes spinach, that includes beans, berries, nuts like almonds, tea, coffee, chocolate, and spinach. And there are a lot of other foods as well. Okay. You need to eat the recommended amount of calcium. This is again very important. Don't cut down on your calcium intake. It is very important for your bone health. It is also important to prevent kidney stones. It does not increase your risk of kidney stones. It helps to prevent kidney stones. So adequate dietary intake of calcium is very important. Calcium supplements should only be taken under medical supervision. Okay, so that's about it. Stones are something that have been there for a long time, but the incidence of stones have increased a lot in the recent years. I think the change in lifestyle, increasing obesity, a sedentary lifestyle, increase in the use of packaged foods that are rich in salt, decrease in hydration levels, all of these are causes why the incidence of stone disease has increased in the recent years. In the West, can somebody guess what is the incidence of stone disease? In percent, can somebody just put it in a message in the chat? Just a guess of, in percent of the population, of the entire population, what percent of people have a stone episode in their lifetime? Can somebody just post a message? I'm looking at the messages right now. Well, it is approximately 10%. So 1 in 10 people have a kidney stone episode at least once in their life. If you look at the population at large, it's still a very large number. So 1 in 10 people are going to have a stone episode at least once in their lifetime. This number is larger for places like India, where the percent is in the tune of 12 to 13%. So it's almost 1 out of every 8 people, if you shall say, is going to have a stone episode once in their lifetime. As I said earlier, having a family history or having a personal history, your own history of a stone in the past, increases that to 40 to 50%. So recurrent stones, yes, are very common. As I said earlier, once you have a stone episode, you have a 50% risk of getting another stone episode in the next 5 to 7 years. The only way you can bring down that percent is diet, lifestyle, and getting rid of obesity and all the other risk factors that we discussed. So I think these are the important things that I wanted to discuss, that I wanted to tell to our listeners today. And yes, before I wrap up, keep hydrating yourself well during the pandemic. If you're seated all the time, try to move, try to get rid of obesity. Don't put on weight. Work out, drink lots of fluids, cut down on your salt intake. Don't binge on snacks, don't binge on cheese, don't binge on chocolate, animal protein, animal meats. Just try to cut down these sodas. So one of the reasons why India, because of urbanization and westernization of our diet, excuse me, and the influence of the carbonated beverages and packaged food and western foodstuffs, along with the kind of tropical weather that we have in India, the influence of the western food diets has made the situation much worse now. And we are finding a much more increased incidence of stone, more so in the young and middle-aged population of our country. So be aware of it. Try to cut down these things. Have a healthy diet, healthy lifestyle. I'm sure each of us can at least bring down our individual risk of getting kidney stones. If you do get a symptom or a stone detected at any time, remember there are fantastic treatment options available. there has been amazing technological advancement in the treatment of stones, and with very minimal access, with very minimal trauma to your body, the stones can be removed and you can get back to work in no time. Stones per se do not damage your kidneys, but stones, when they cause obstruction or infection in your kidneys, can cause serious damage to your kidneys. So you do need to get appropriate treatment for the same. Thank you very much. Stay healthy, stay safe. I'll just have a very quick look at the messages right from the top. I'll try to answer some questions before I close up. Okay, somebody asked what causes kidney stones to form. So I think I've fairly outlined the reasons for kidney stones in detail. Could I have a kidney stone and not have any symptoms? Yes, absolutely. As I said, asymptomatic patients where a stone gets detected just on an imaging. What are the signs that I may have an infection? All right, just like any other urinary infection, you may have burning sensation while passing urine. There may be an increased need to go to the washroom, and there may be an urgency where you're finding it difficult to postpone passing urine. It may be associated with a fever, with chills usually, and nausea and vomiting. These are classical signs of having an infection in the urinary system, and if you have this, you should try and seek treatment urgently. Are there any long-term consequences of having a kidney stone? As I said, stones per se do not cause damage to the kidneys, but if they are obstructing the kidneys or they are predisposing to infections, they can definitely cause damage to the kidney function. Which type of kidney stone is the hardest? So calcium oxalate monohydrate is a type of kidney stone. It's fairly common. It's the hardest of the stones. The Sistine Stones are quite hard as well. How much water and liquids should I drink every day? How do I know if I'm drinking enough? Great question, Uttara Rose. Okay. So I think I highlighted this in my talk. 2.5 to 3 liters. So while I was in the UK, I noticed the kind of water bottle that they sell in the supermarkets there, which is markings for every hour on it. So if you fill up a bottle at 8 a.m. in the morning and then keep it with you, there's a marking for 9 a.m., 10 a.m., 11 a.m., 12 a.m., 12 noon, 1 p.m., 2 p.m. So by 2 p.m., you're supposed to finish that bottle, say in 6 hours. You finish one bottle, 1 liter of water in 6 hours. When you look at that hour marking, if you've not reached there, you just open the bottle and try and reach up to that. I found it to be a fantastic way of reminding ourselves to drink water at regular intervals. You can do that with a normal bottle even at home. You can just use a marker. I found it to be a very effective way of reminding ourselves. In the current situation where most of the people are working from home, it would be great if we kept a liter bottle in front of us with these markings, and we just look at the bottle, and if we've not caught up, it's 1 p.m. and half of the bottle is left. We just pick up the bottle and make up for the intake that we have not done. So 2.5 to 3 liters per day. And how do I know if I'm drinking enough? The color of your urine is the best way you're going to know. If it's a light straw colored urine, you're probably drinking enough water. Is it okay to drink coffee, tea or soft drinks? All three are culprits in formation of kidney stones. In small quantities, 1 to 2 cups per day, it's fine. But if a person is binging on any of these, you're increasing your risk of stone formation. What would happen if a kidney stone is left untreated? I've already answered that. If I'm suffering from kidney stone problems, should I control my calcium intake? Very common question. So, no, you should not control your calcium intake. Reducing your calcium intake in food is going to further increase your risk of stones. So keep your calcium intake adequate, because otherwise your bone health is going to go down. and your bones are going to get resorbed, and they're going to further increase the calcium levels in your blood and your urine and increase the risk of stone formation. So do not bring down your calcium intake. Do not cut down on your milk and dairy products and whatever natural sources of calcium that you're taking. Is infection responsible for kidney stones? Yes, for certain types of kidney stones. As I said, struvite stones or infection kidney stones form more commonly in patients who have recurrent urinary infections. Can kidney stones cause GI problems? So directly, no. Kidney stones do not cause GI problems directly, but GI problems can cause kidney stones. As I said, diarrhea for a long time, inflammatory bowel conditions like Crohn's, ulcerative colitis, gastrosurgeries like a gastric bypass, all of these can cause kidney stones. What size kidney stone requires treatment? This is a very subjective question. It does not have an objective answer to it. So based on the location of the stone and your presentation, the decision is made by a urologist whether you need treatment or whether you are good for watchful waiting. All right, I think I've answered most of the questions. How to prevent children to get kidney stones below 5 years of age? Okay, so children are at a lower risk of developing kidney stones. One scenario where they do get kidney stones are when they have some metabolic disorders. These are usually genetically inherited. So if your child is normally hydrating well enough, the risk of forming kidney stones is very, very small. And if they are forming kidney stones, they need to be seen by a pediatrician as well as a urologist. And they need a proper hormonal evaluation to find out what's wrong. Foods that I can eat, foods that I should avoid. I think I've spoken a lot about these things. And this is one thing that is fairly easily available on the internet. So you can just Google it and find out. Oxalate-rich foods should be avoided. And animal protein should be kept to a minimum. Fruits and veggies in general are good to prevent kidney stones. Can I get recurrent stone issue? Yes, absolutely. There's a very high risk for getting recurrent stones. Recurrent stone of small size, approximately 4 millimeters, what treatment to be taken? So there's a general rule of the thumb that stones up to a size of 5 millimeters have a high chance of passing out on their own. But this is just a general rule. As I said earlier, the decision or your condition will actually be decided upon the presentation, the location of the stone, the presence of any other complicating factors. So you cannot make a generalized statement about what's going to happen. But a 4 millimeter stone without any symptoms probably does not need treatment at this moment in time. But if you are forming recurrent stones, you need to make sure that you're following the diet and lifestyle advice so that you decrease your risk of further formation of stones. What is the chance of a newborn's kidney stone? Again, if it is an inherited disorder, a genetic inherited disorder, very rarely a newborn may be born with a stone in their kidneys. But the incidence of such events is very, very small, and usually they are operated upon, as I said, with finer instruments available these days. We are able to operate on very, very small children, even on infants, and get rid of the stones with the help of minimal access surgery. All right, I think I've spoken about the basics of kidney stones in brief, and you can always reach out to me on my Facebook page. You can reach out to me on the various social platforms that I am on. Take care of your health, take care of your kidneys, hydrate well, and stay healthy. Thank you very much. Thank you. Bye-bye.